Arthritis, that dreaded monster that plagued your grandparents and is now creeping its way into your life. But do you know enough about it? Or is it just another frightening medical mystery to you? If that's the case, put your detective hat on and let's get to work. Basically, there are two main types of arthritis. Osteoarthritis. This is when, in an injured joint, the damaged part of the bone ends up closing down the joint space, causing the bones to wear on each other, leading to inflammation and erosion of the joint space, as well as restricting movement. The other type is rheumatoid. With it comes joint deformity and most likely disability. The pain that comes with this type is a lot greater than that of osteoarthritis. Ouch! Those are the two most common ones, but there are other forms of arthritis. The others include gouty arthritis, or simply gout, a type of joint disorder where painful crystals form in the joint and cause disability, and psoriatic arthritis. This one doubles as arthritis in the joints, but is also accompanied by a visible fish scale type of rash on the body. That all sounds pretty dismal, doesn't it? Fortunately, we live in the information age, and we've shed a lot of light on how it all works. For example, we now know some of the reasons our joints scream when the arthritis comes knocking. Things like our stem cells decreasing with age, curbing tissue regeneration, a poor diet causing too much inflammation and nutrient deficiencies, and not letting injuries heal completely, all of which can worsen not just the arthritis, but the pain that comes with it. And pain is a very important element in all of this, because what you may not know is that someone can have an advanced case of arthritis that is very obvious on x-rays, yet feel very little pain. They may get along just fine during their day, and movement may be minimally restricted. This gives us hope, and perhaps an idea, that if we change our diet in some major ways to address the different reasons inflammation can run rampant in the body, we may positively affect our own arthritis pain on a day-to-day level. The ultimate answer must be tailored to your individual needs and nutritional status, as well as health history. But do nothing without your doctor's blessing and guidance, of course. The question stands, can natural herbs and supplements help with inflammation and arthritis management? That's what we'll focus on in this video, by taking a closer look at the 7 study-backed supplements most helpful for arthritis. First on our list are omega-3 fatty acids. During the past 3 decades, there have been several clinical trials of how fish oil containing omega-3 fatty acids affects rheumatoid arthritis and osteoarthritis. There have been 20 clinical trials in rheumatoid arthritis, and 16 of them showed significant improvements. 4 clinical trials were done on osteoarthritis, and 3 of them exhibited significant improvements in at least one clinical parameter tested. So, how does omega-3 fight arthritis? In a nutshell, it suppresses the production of cytokines that cause inflammation, creating a more anti-inflammatory state, reducing pain, and possibly halting cartilage degeneration. Next up, we have proteins, whey, and collagen specifically. Doctors in Denmark tested the protein metabolism of muscles in 13 rheumatoid arthritis patients, compared to healthy people without rheumatoid arthritis. They found that the rate of protein synthesis in the muscle was different from normal in those with arthritis. The doctors also found that protein intake could stimulate the rate of muscle synthesis in those with arthritis, and it would do this more than in those who are healthy. Here's where it gets even more interesting. Physical exercise also stimulated muscle synthesis, and if exercise was combined with protein, the response in the body equaled the normal rate of protein synthesis in healthy individuals. Yet another reason to exercise today. Next up, we have branded chain amino acids, or simply BCAAs. There are 20 amino acids your body needs. They are the basic building blocks for tissues, organs, muscles, skin, hair, among other things. Basically, they're necessary in keeping us alive. BCAAs are a group of 3 different amino acids that have a particular chemical structure that the other 17 amino acids don't have. These 3 BCAAs are leucine, isoleucine, and valine. For starters, BCAAs are important for good joint function in frail and pre-frail elderly people requiring long-term care. For example, Japanese researchers put elderly individuals on an exercise program that they weren't used to. 3 sets of exercises at 30% maximum contraction for 5 different body parts, 1 set of aerobic exercise, and 1 set of balance training. You might think this amount was way too much for them. However, it was designed only to make them stronger. The researchers gave each person 6 grams of BCAAs, or a placebo, 10 minutes before starting exercise. Those who received the supplement were 10% stronger in lower limb muscle strength on the leg press and knee extension, and had better balanceability. There also seems to be a difference in amino acid profiles in those with rheumatoid arthritis compared to those without the disease. When arthritis patients fasted for 7 days in a hospital setting, their amino acid levels were monitored. Greater levels of increase were seen in sulfur-containing amino acids, which may have been because of greater glutathione breakdown. But the smaller levels of increase in the branched amino acids suggest that rheumatoid arthritis patients react to valine, like other patients who have muscle-wasting diseases. Another report from Chinese research states that osteoarthritis patients may also have alterations in the metabolism and profiles of amino acids. The scientists concluded in the Amino Acids Journal in 2016 that some amino acids have the potential to act as immune modulators, working against inflammation in the joints. Phew, that's a lot of science talk. Let's keep going, shall we? Next up, we have a more familiar sounding name: vitamin D. As it turns out, patients with rheumatoid arthritis are notorious for their low levels of vitamin D. In one Moroccan study of children with the disease, 75% of them were deficient in this important vitamin. In Brazil, scientists discovered that there are effects of vitamin D on the immune system. The vitamin enhances the body's ability to fight infection. Yet patients with rheumatoid arthritis are often given treatments that suppress the immune system, leaving the joints open for attack by microbes. In fact, researchers agree that the lower the vitamin D levels in a rheumatoid arthritis patient, the more severe the clinical manifestations of the disease will be. And it's not just rheumatoid arthritis. In Thailand, researchers found that low vitamin D levels are common in patients with osteoarthritis too. 59% of their 175 patients with knee arthritis had deficient levels. Yet, after supplementation for 6 months, the vitamin D levels were only at 32 nanograms, just barely into the normal range. During the 40,000 IU vitamin D supplementation per week period, however, the patient's pain level and quality of life improved significantly. Their grip strength also improved. Vitamin D supplementation is also effective in improving the stiffness, pain, and function of those with osteoarthritis in the knee. According to Chinese researchers analyzing studies totaling 1,136 patients with the condition. However, they commented that there's a lack of evidence to prove that it prevents the progression of the condition. Vitamin D sounds promising, and we'd love to see even more research on it. Next in line, we have another vitamin that may have some role in fighting arthritis: vitamin C. In an old laboratory study from the late 1970s, 2 researchers discovered and reported that high levels of vitamin C eradicated arthritic cells. It didn't cause negative effects on normal cells either. Interestingly enough, aspirin, which is a common pain reliever, reduced the number of both normal cells and arthritic cells by about 20% compared to controls. However, we're all about being up to date, so we'd love to see more credible recent studies on vitamin C and arthritis. Speaking of vitamins, our next supplement is a collection of them. I'm talking about multivitamins, of course. If you had an 83.5% chance of improving your joint symptoms, would you try a therapy that included a multivitamin, eliminated milk, wheat, rye, barley, oats, sugar, yeast, and added supplements of omega-3 fats and curcuminoids and probiotics? 104 patients in Helsinki, Finland agreed to give it a try, and 88.6% of them reported distinct benefits, one of the benefits being a lesser need for conventional medications. Side effects were few and mild. We'd love to see more studies, but that sure does sound promising. Finally, we come to multi-minerals. Although studies are in no way complete for assessing the effects of all minerals on the health of those who have arthritis, some things are known. Researchers at the Albany Medical College reported in 1996 that patients with rheumatoid arthritis are deficient in magnesium and zinc if the recommended daily allowance levels are considered. And if the typical American diet is considered, then copper will also be low. Researchers from multiple universities worldwide reported in the Journal of Trace Elements in Medicine and Biology in 2018 that selenium levels may play a role in the connection between cardiac disease and rheumatoid arthritis. When selenium levels rise, there appeared to be a decrease in the inflammatory markers. Selenium is one of several antioxidants the body uses for good health and to combat oxidative stress. Trace elements such as copper and zinc also fulfill this function in the body. This is why scientists in the UK designed a study to see whether or not trace element status is involved in the development of rheumatoid arthritis or the progression of it over time, comparing about 100 patients with rheumatoid arthritis to another 100 healthy individuals. They found that low levels of zinc and selenium and high levels of copper were associated with the presence of rheumatoid arthritis. Another study showed a significant correlation between selenium levels and the number of joints affected with active arthritis, as well as the limitation of movement in those joints. Other scientists believe that the lower levels of selenium and zinc in patients with rheumatoid arthritis are probably due to the disease and mediated by inflammatory-like substances. Another interesting find is that osteoporosis is common in Chinese patients with rheumatoid arthritis. This suggests multiple vitamin and mineral deficiencies. One study of 304 patients with rheumatoid arthritis found that supplementation with calcium and vitamin D decreased the risk of developing bone density issues in patients with the disease. In fact, 20% of the group that took supplements experienced low bone density after 4 years of supplementation, compared to 64% of the group that did not take supplements at all. Phew, that was a lot to take in, but you made it. Now, where do you go from here? Well, keep in mind that these are but a few of many supplements you can consider which may help manage the pain if you have arthritis. But as always, please speak with your doctor before making major adjustments to your diet and/or lifestyle. Some of these supplements may interact with other medications you may be taking, and some may bring about side effects not mentioned in this video. Oh, and one more thing. If you enjoyed this video, be sure to hit the like, subscribe, and the notification button below. Thanks for watching.